Hello, everybody, and welcome to the first Independent Sage briefing of 2022. And I hope that the start of the new year finds you safe and well. Now, earlier this week, the Prime Minister said he hoped the UK would be able to ride out the current wave of Omicron without the need to impose any further restrictions. At the same time, 24 hospital trusts have now declared critical incidents due to a combination of staff shortages and increasing hospital admissions. And the army is being called in to help out as well. In England, more than 1 million cases were reported in just the last week. And the latest ONS infection survey suggests that around 1 in 15 people currently has COVID. With a lack of testing capacity at the moment, it's likely that that is actually an underestimate. Independent Sage has come up with some recommendations for short-term protective measures that we think are really necessary at this point to stop the further spread of Omicron. And Dr. Helen Salisbury will be talking us through some of those recommendations today. But first, as usual, let's have a look at the latest facts and figures from Professor Christina Pargle. Christina, over to you.
Right. So, Happy New Year, everyone. So it's been 3 weeks since the last briefing, and I think it's fair to say a lot has happened. So I'm going to try and cover most of it today in not too long, but we'll see how that goes. So I'm going to start with an update on Omicron, then go through vaccination cases. The latest long COVID survey came out yesterday from ONS, so I think that's worth going through hospitalizations and deaths, and then a summary before handing over to Helen. So Omicron has rapidly increased. This is the proportion of sequence cases that are Omicron by week by home nation up to Christmas Day. This data goes up to. So you can see that it's well over 80% of cases for Wales, Scotland and England. We haven't really got any data from Northern Ireland since the 17th of December. But Northern Ireland is probably a week or two behind the other nations. So just bear that in mind, that actually Northern Ireland's Omicron surge is a little bit behind. If we just look at COVID variants in England over time, for the last 18 months, just you can see quite how quickly Omicron came. So Alpha went from 0 to 80% share of cases in about 11 weeks. Delta took 7 weeks. And bear in mind that both of those were under lockdown conditions. But Omicron's done it in 4 weeks, and not just here, but in pretty much every country that it's hit around the world. Originally, the eyes were on London as it was started here, really, the surge, but it's now every single region in England is over 90%. Omicron, London is probably a week ahead, but not more than that. So the other thing that we now know a lot more about, thanks to the UK Health Security Agency, which has just been world leading in getting vaccine effectiveness estimates out there, is how well our vaccines are working against Omicron and how that compares to Delta. So the first thing I want to show you from the most recent report that came out today or yesterday is the effectiveness of vaccines against infection, symptomatic infection. So you're actually feeling ill because you've got Omicron or Delta. So this is a plot that goes from negative values to 0. So 0 is there's absolutely no difference between having the vaccine and not having the vaccine, up to 100%, which is the vaccine completely stops you getting infected, or at least getting symptomatic infection. And the black squares are Delta and the round circles are Omicron. And this is time since dose. So this is for 2 doses, and this is 2 doses of AstraZeneca. And you can see that even with Delta, after about 25 weeks, you only had about 40% protection from getting infected. And that's partly why in December and November, we were still seeing really high Delta cases in England. For Omicron, if you've been vaccinated, your second dose more than 25 weeks ago, it basically gives you no protection against infection at all. If you're boosted, and it's pretty much the same for whether it's a Pfizer booster or a Moderna booster, then that if it was Delta, it would bump up your protection against infection to almost complete protection. It was really, really effective. Against Omicron, it's less effective. So somewhere between 40 and 60% protection against infection. Now, that's a lot better than nothing. It definitely will help to slow transmission, but it does mean that after 10 weeks, don't be surprised if you actually caught COVID and got infected. So the key thing is how well do the vaccines work against hospitalization? And here it's kind of a mixed picture. So if you're 25 plus weeks from your second dose, then you only have about 50% protection against hospitalization against Omicron. And that is much lower than it was with Delta, but it's still a lot better than if you hadn't been vaccinated. Now, the key thing is that with the booster, that pushes you back up to 88% effectiveness. So that gives you a lot of protection against severe illness. But I think it's still important to remember that it's not as good as versus Delta, where it was almost 100% protection against hospitalization after your booster. So it's really good that the booster works, and that's why we've done this big booster campaign. And you should definitely get your booster, but we're still not in a situation. We would have been in a better situation if we had never had Omicron. So since vaccination is so key, let's have a look at where we are. So this is the kind of vaccine status for each of the home nations, where dark green is fully boosted and red is unvaccinated. And you can see that England, Scotland and Wales have all got more than half of their entire populations boosted now, which is really, really good and rapid. Northern Ireland is a bit behind. So that is a bit concerning, as they're now just entering the Omicron wave. They also have less protection from boosters. But we still have a significant proportion of the population that is firstly vulnerable to infection because they've not been boosted, so they're not really getting any protection against infection, and also unvaccinated. And many of these are children, particularly the under 12s. This is just kind of showing you in the numbers, and really we had that really big effort to boost people before Christmas. We were getting to almost 1 million doses a day for several weeks, which was really quite heroic efforts by the NHS, but it has really dropped off since Christmas. And we still have about a quarter of adults who haven't been boosted. So, there's still work to do here to kind of say, well, we haven't done it. We haven't finished our booster program yet. We haven't finished our vaccination program yet. And when we look at teenagers, 12 to 15-year-olds and 16 to 17-year-olds, especially as term has now started, you can see that although we've made a lot of progress since the summer, we've still only given a first dose to about half of 12 to 15-year-olds in England. It's almost 70% in Scotland and Wales, but again, less than 50% in Northern Ireland. And 16 to 17-year-olds are high, but they could be higher, particularly in England and Northern Ireland. And this is just showing you kind of the vaccine status by age in England now. And what is the kind of the saving grace of where we are with Omicron in the UK is that we have really, really high booster coverage in the over 60s. And that is protecting hospitals. And that is partly also why I imagine many European countries and North America will struggle a bit more, because they do not have this really high coverage. But we still have a lot of more unvaccinated children than European countries and the US. And we also have a lot of work to do here, where there are a lot of adults, younger adults, who still haven't got their booster. And we also have this persistent difference by deprivation. So this is booster coverage by age, where green is the least deprived, people in the least deprived areas, and red is people in the most deprived areas. And there are large gaps in coverage for every single age group, even the older age groups. And this matters. It means that the impact of Omicron will again be felt disproportionately. And we also see a really large gap in first dose coverage for 12 to 15-year-olds by deprivation, where less than 40% of children in the most deprived areas have had a first dose of vaccine, compared to almost 70% in the least deprived. So looking at cases now, So this is the number of new UK confirmed cases by reported date up to yesterday, the 6th of January. When I did the last briefing on the 17th of December, we had data up to the 16th. We had 88,000 cases, and that already seemed massive and unimaginably high. We now have had one day where we've recorded more than 200,000 cases across the UK. And in fact, in the last 3 weeks, we've had almost 3 million cases reported, which is the same as the entire 12 weeks before the last briefing. And that was already in a situation where we had really high cases for weeks and weeks on end. If we look at it by nation, this is by date of test up to New Year's Eve. You can see all nations are extremely high and rising. It's a little bit worrying quite how high Northern Ireland is, given that it's a little bit further behind in its Omicron wave. And this is also bearing in mind that testing is now strained with just the sheer numbers of people getting affected. Many people with a positive lateral flow test will not get a PCR. And now, in fact, many people are being told not to if they don't currently have symptoms. And even if they do have a positive lateral flow test, they won't necessarily register their test online. They might just informally isolate themselves. And so it is quite hard to know exactly what's going on just from the case data at the moment. And that's also affected because it's been Christmas and New Year, and people generally seek testing less over those time periods. And this is also reflected in just the positivity rate, the proportion of tests that are coming back positive. Positivity rates in all the home nations are really sky high. In Wales, they're over 50% of people getting a PCR test testing positive for COVID. In England, it's about 35%. And in Scotland, it's approaching 30%. I mean, it's really, really high numbers, and that's partly testing strain and partly a reflection on people choosing to get tested. The ONS survey came out this week. The most recent data is up to 28th of December 2021. And this is their modelled percentage of the population who would test positive for COVID. In England over time, this does not depend on testing behaviour, it does not depend on symptoms or test availability. And this is where that 1 in 15 number comes from. The most recent number is 6%. And you can see it's 3 times higher than pretty much anything we saw pre-Omicron. So here we had just over 2% for the alpha wave and just about 2% when we had the big October Delta surge a few months ago. So just in the last few weeks, this has risen massively. Interestingly, for ONS, they have England having the highest prevalence. So this isn't quite the same as new infections because people can test positive, several days, sometimes weeks into having had COVID. But I think this is also partly because England does not count reinfections at the moment in its case data. So if you had COVID a year ago and you got a positive test and you have it again now, you will not appear in the headline figures for England, but you will for Wales and you would for Northern Ireland. And I haven't quite been able to work out whether you do for Scotland or not. That will change. They are going to change it by the end of January, but it isn't there yet. But they are reporting reinfections in the weekly report for England. And yesterday it came out and they said in the 2 weeks to the 31st of December in England, there were 140,000 reinfections. So a lot of people getting reinfected, not surprising because we know Omicron is quite immune evasive, but these will not be in the daily counts. And basically it's about 10% positive cases in England are confirmed reinfections. So the actual numbers will be much higher because not everybody got a test the first time around. Just looking at England by region, you can see all the regions are still rising really fast, except London, which had its highest cases just before Christmas, then came down and is now flat. And I'm going to look a little bit at London in a bit. The northwest and the northeast are now the highest areas in terms of cases, with extremely high numbers of people testing positive. Positivity rates are going up in all regions in England, including London, which implies that at least some of the drop in cases in London is because of testing and not because of a genuine drop. ONS today also looked at regions, and again, a number of people who were tested positive. Now they have London possibly peaking here, just under 10% of people in London tested positive just before Christmas, and that's gone down to 8.8%. All other regions are increasing. What is unclear in London is exactly what will happen after New Year. So I'll say that, as I said, I'll talk about that in a minute. If we look at it by age group, this is over the whole of England up to 1st of January, every age group is increasing. Highest are 20 to 49-year-olds. The more kind of worrying thing from a hospital point of view is that 50-somethings and over 60s are also going up steeply and are actually at higher levels than they've ever been. And I've just highlighted that 0 to 4-year-olds are going up as well. They've pretty much nearly always been the lowest group. They are going up and off, and you'll see why later. And in the ONS survey that came out today, they actually have the highest age group being 18 to 24-year-olds, which kind of matches this. 8.3% of them testing positive, but actually really, really high rates in primary school children. Now, some of that just reflects really high infections in the last week of term and onwards, but some of it could be that actually primary school age children are less likely to get tested, less likely to show symptoms, and their symptoms are less likely to be typical. So it kind of, I think the ONS is showing you a truer picture of how high infections are, and it's relevant because everyone's just gone back to school, and they've gone back to school with higher prevalence than they've ever had, easily that they've ever had. And also this age group has just gone back to university. And again, but hopefully this group is well vaccinated. And just quickly on London, so this is under 50s in London, and you can see these quite strong peaks just before Christmas. But in the last just a few days, it's flattened out, and this ends on the 1st of January. And so what we don't know is what is the impact going to be of New Year, and also on these younger age groups, what is the impact going to be on return to school? We nearly always see cases dropping in children over school holidays. And if we look at the older age groups in London, the over 50s, they have been climbing steeply all the way up to New Year, and only now, maybe possibly the over 70s, potentially plateauing. And we haven't seen this yet hit the hospitals, and we don't really know how these increasing rates plus the booster is going to impact on hospitals over the next couple of weeks. And just the final slide on cases. So outbreaks in care homes have gone up a lot over the last 2 weeks, and they're higher now than they were in the peak of the wave last winter. However, care home residents are really well boosted, and we know that boosters are effective in preventing severe illness. So hopefully these outbreaks won't result in a lot of hospital admissions. So just a bit on long COVID. So the ONS, every month, it asks several 100,000 people about persistent symptoms after having had COVID. And I'm going to start just by symptoms lasting at least 12 weeks, because that's more of an internationally accepted timeframe. It's 3 months since your first symptom. And this is by age over time. So every month I've taken the data and plotted it. Now, the data released yesterday is collected in November, and it's about infections before that. And so if you wanted to get 12 weeks before that, you're actually, for 12 weeks, you're looking at people infected over the summer. If they're affected after September, they won't appear in the 12-week numbers for January. But you can see that although rates of long COVID are reasonably stable in over 35s, they've been going up in children, and they went up quite a bit in young adults, and that's now coming down a bit, partly because people are resolving quicker than they're getting affected. And that is good news, although there were really high infections over the summer, which is what this peak represents. But we can also, they also report it by 4 weeks. So I'm going to move now to looking at it by 4 weeks, because that allows us to look at the impact of last term on long COVID. And so this is it by 4 weeks. And really this red bar here really represents the new children infected in September and most of October. And you can see these really quite steep increases in 12 to 16-year-olds, but also in 2 to 11-year-olds. So although they have lower absolute rates, they're the groups that are really increasing rapidly. And so are the age group of their parents. I just wanted to look at 15 to 29-year-olds here. So this is the number of new confirmed cases by month, 15 to 29-year-olds. And basically, these drops here reflect the drops in cases that we saw over autumn. Now, this is the last month where any data would have entered into this survey. And what we've seen is these really enormous cases in this age group through Omicron. And we have no idea what Omicron means for long COVID. We don't know if you're more likely to get it or less likely to get it. We know that vaccines did seem to work in reducing rates of long COVID with other variants. We don't know if that's true or not for Omicron. So it's possible that we will see rates in this age group increase again. If we look at the same thing for children, we can see that these really high cases in the beginning of in the first half of last term have now resulted in many more children reporting long COVID, and the really high cases that continued in November and December are not yet in these numbers. So unfortunately, we should expect this to keep going up. And these children are mostly not vaccinated. The other thing to point out that ONS said is that long COVID disproportionately affects people in most deprived areas, but also people who work in healthcare, social care, or teaching and education. So it does matter. You know, if you have really high cases, then the people who work in professions that have to that work with the people who might be infected are also at higher risk of getting infected and getting long COVID. So hospitalizations and deaths, the last section. This is the number of people in hospital with COVID across the UK nations, adjusted for population. You can see that all nations are rapidly going up. Northern Ireland is going up a bit slower, but again, it's about a week or two behind the other nations. And if we just look at this kind of bar here, kind of shows you where the peak was in the first peak in 2020. And you can see that actually we're not that far away from having the same number of people in hospital as we had then. And we're about one doubling away from having the same as we had last January. And I know kind of some people saying, oh, well, that's okay. You know, we're not as bad as we were last January. You know, we came into this winter with a really highly vaccinated population and actually a pretty highly boosted population. We'd also tolerated high levels of infection over the summer and over autumn, including high levels of hospitalization, on the grounds that that would give us some kind of immunity and protect us in winter. That has not been the case. I don't think we should say that because we're not as bad as we were in a situation without vaccines, that this is okay, right? We were in a much better position and we should not be here. And it does matter. You know, the NHS is not as resilient as it was before COVID. Backlogs have built up, staff are exhausted, and there's also now the additional problem of loads of staff being off sick. We just don't have the spare capacity with which to cope with these kind of pressures. And there's also been a lot of talk about, are people coming into hospital just because they happen to be infected or because they are actually sick with COVID? And what you're seeing is that since Omicron hit, so around December, it's both. So the number of people actually in hospital because they've got COVID is going up rapidly, as is the number of people who come to hospital for another reason and happen to have COVID. Now, this proportion of people who are there directly because of COVID has come down. It was about 74% in November, and it's come down to about 63% now, but it doesn't mean that it's not a problem. And these blue people include people for whom it's entirely incidental. They have COVID, they might not have any symptoms or whatever. They also include people who might have caught COVID in hospital. So they might already be sick and then have caught COVID, which is not a good thing. And even if you have COVID incidentally, you still need to be in a separate ward. You need to have infection controls. It actually adds a lot of burden to how you treat people. But the good news is that the number of people in mechanically ventilated beds is not changing. It is not going up. So I think that it is true that the Omicron seems to cause less severe disease in the lungs. And so people are needing to go to intensive care and mechanically ventilation much less. So this is where we were in the first peak. I don't think there's any suggestion that we're going to get anywhere near that with Omicron. But this is kind of showing you the staff absences, and it's kind of been in the news today. So the dotted line is last year's average, and the dashed line is the average from 2019-20, percentage of staff off sick. And you can see how in England it's been going up, and it's now over 8%. So it's gone up a lot because of Omicron, from a situation where it was already higher than previous years for the whole of the summer and autumn. And regionally, actually, London is not the worst off. The worst off is the North and the Midlands, who have really high rates of staff off sick, almost 10%. And also that's increased a lot just in the last week. So in terms of admissions into hospital, when hospitals are struggling, as we've just kind of been seeing, we've seen a few days, several days, over 2,000 admissions a day. That's not that far off the peak in 2020 and about one doubling away from the peak in January. It has kind of been flat, but again, Christmas and New Year kind of stuff things up. So, and we know that cases have been going up in older adults. So it's really kind of the next 2 weeks are key. It's really too late to stop what's ever going to happen. The people who are going to need hospital in the next 2 weeks already have COVID. And regionally, you can see that it looks as if London has been coming down over the last few days. Well, it's come down compared to before Christmas, but actually the last few days it's gone up a bit again. So because cases have been going up in older adults in London, I'm not entirely sure this will keep going, but all the other regions have been going up, and the Northwest is the highest by quite a long way right now, and that kind of reflects its caseload as well. In terms of age, cases look like they might be flattening in 18 to 64-year-olds, but it's still going up in over 65s and over 85s. But this is the plot I'm a bit also quite worried about, and this is admissions for children. So remember, children mostly, if they have a vaccine, they have one dose, and under 12s don't really have any doses. And since Omicron has arrived, the number of admissions per day in under 5s has really gone through the roof. And I don't know whether that's from COVID or with COVID or whatever, but it's noticeable. It's really, really noticeable quite how much higher this is. And we're not the only country reporting this. America's reported this, France is reporting this, Canada's reporting this. So it's not really clear what's going on. As far as I know, it's not intensive care. It's, it's just the wards, but this is definitely a thing. And in fact, I think we often forget with children, because they haven't been vaccinated, that the pandemic hasn't really changed for them. And so if you look at daily COVID hospital admissions in England for all children, so 0 to 18 years since the start of the pandemic, and I've done it here, just raw counts by variant, and you can see this is kind of the original variant up to December. Then you had the Alpha wave, then you had the Delta wave, and actually the Delta wave was pretty bad for kids compared to previous waves, really high, consistent levels of admissions for children. But then in Omicron, in the last 3 weeks, admissions have really just shot up. And more children have been admitted in the last 3 weeks to hospital than over the whole of the first wave from March to August 2020. So I do think we have to stop being so complacent about the idea that children are absolutely fine if they get COVID. In terms of deaths, these are reporting spikes, so don't take them too seriously. At the moment, deaths are still pretty flat, but well over 100 deaths a day by date of death. What we don't know is how these cases and hospitalizations are going to translate into deaths. If fewer people are needing intensive care, it might be a good sign that actually deaths won't go up that much. But again, we will find out over the next week or two. So last slide, just kind of summarizing where we are. So Omicron is now the dominant variant in the UK. You really do need a booster for good protection against hospitalization. And after 10 weeks, boosters only provide kind of moderate protection against infection, so about 40%. Cases in the UK are far higher than they've ever been. Now, hopefully now freshly boosted young adults, so a lot of young adults got boosted in December, and that now will have kicked in. So hopefully that should provide a break on transmission while the booster's fresh, along with the fact that so many have been recently infected. The fact that older adults whose boosters have waned a little, but have such high levels of booster protection will hopefully reduce severe illness. The number of admissions and number of people in hospital are very high, but that pressure is not translating into intensive care. So the NHS is struggling, not really in intensive care, but it's because not only are there rising emissions from COVID, not only is there loads of normal work, which has been delayed because of COVID and just needs to happen now, also because they've got really high level of staff sickness. Long COVID rates are increasing, particularly in children. We do not know about Omicron and long COVID. We do know that vaccines are likely to provide some protection, but again, with Omicron, we just don't know. It's just too soon. The first person known to have been infected with Omicron probably only got it about 8 weeks ago. So we just don't know at all about it. And finally, children are returning to school with really, really, really high rates of COVID, with an incredibly infectious variant and very little, if any, protection from vaccination. So if you do not address transmission in schools, the Omicron wave will be prolonged in the whole country for everyone by weeks, just as we saw really high cases of Delta all the way through autumn, driven by schools. And it's not just about children, it's also just the number of staff absences. Schools are already really struggling with the number of staff they've got off sick. And that is where I'm going to end.
Christina, thank you very much indeed for that roundup of the facts and figures, extremely comprehensive as always, and giving us some context. We're now going to go to Dr. Helen Salisbury, who's going to present a new short statement from Independent Sage on a COVID protection and support strategy for January 2022. Over to you, Helen.
Thank you very much, Alice. We're just going to show a few slides really to talk about what we might do in the situation that we're in. Kitty, have you got slides there? There should be some slides to show. I'm really sorry, I haven't got them for me. Kitty, are they there?
I think you can be forgiven, Helen, because even at the official briefings, they don't seem to have got a slide advancer yet. So while we're waiting for those slides, you want to kind of summarise? Really,
yes, really, we would like to. There has been a kind of real pushback in some quarters against the idea of restrictions for COVID, and when anybody suggests that we should do something to reduce the amount of COVID around, people say, oh, you want us to lock down again. That's really not very helpful. If we want our society to carry on functioning, if we want our NHS to function and be able to do all the things it needs to do, as well as look after people with COVID, we need to reduce the amount of the virus that's out there. And that means protections. It means things to stop people getting infected, and it means support so that people can be supported to isolate, because lots of people can't even do that. They don't even test because they know they can't afford to take the time off work. So we need to get a robust and comprehensive system of protection and support. I think we'll have the slides in just 1 second. We wanted to put forward a list of suggestions which are not restrictions. They're not about lockdown. They're not about stopping people doing things, but they are about thinking about ways we can slow the spread of Omicron, because at the moment we are really, really worried that we're not going to or rather that many parts of our societies, the schools and the healthcare sector, just won't carry on functioning if we carry on with the high levels that we're on now. Okay, if you'll just give me 30 seconds. Here we go. We have so here is our new report, and we've actually had 3 million COVID cases almost entirely due to the Omicron variant since this December the 1st. And actually, we were told again and again that that everything would go wrong. Sage warned the government that we would have unsustainable pressures if nothing was done over the festive period. We've kind of missed that boat. What will happen now is the cases are now kind of baked in, the ones that we've got. What we do need to do is put some protections in place, and it starts off by communicating well. We can just go back up to where we were. There are an enormous number of people who still don't have a clear idea about the risks that we face. Lots of people still seem to think that, you know, this one's mild, this one's not a problem. And it may be that they themselves won't be very ill, but as Christina's figures have shown us, people are getting ill enough to need to be in hospital, and it is posing a huge risk to us all. So we need to make sure that people know there's a risk. We need to make sure they know what symptoms to look out for. If you go on the government's website, they're still talking about the symptoms that were associated with the original COVID. We're talking about cough and loss of taste and smell, and high fevers, and that's really not what people are presenting with Omicron. These are much more like ordinary cold symptoms: runny nose, headache, fatigue, sneezing. People need to know what to look out for and to get tested when they do. They also need tests to be available. We need to ensure that that people understand how COVID is passed on. A lot of people are still really focusing on objects and hand hygiene and making sure they don't touch things that other people have touched. And we know that is, although it's good in terms of general infection control, not very relevant to COVID, because COVID is airborne, and we need to be making sure that there's really clear public messaging about good quality masks and indoor air quality as the main protections. And because it's airborne and because it's so catching, we also need to think about getting people to reduce their number of social contacts to minimize that spread. And a lot of people have been doing that themselves. If we think about how we can protect people, how we reduce those social contacts, actually it's about working from home. It's about colleges and universities moving their teaching to online. And actually where people are gathering, we need to look at air quality. We need to have carbon dioxide meters, and when they show high, we've got to either ventilate so the levels go back down again, or provide air filtration so that the virus is removed from the air. We are still, when you see most people, if they're wearing a mask, an awful lot of people are still wearing very flimsy masks. It's still happening in healthcare. It's definitely happening in schools and in the general public. We really need people to be using what are called FFP2 masks. These are the ones that stop that actually filter the air, rather than the air coming round the edges, which they do with the little surgical masks or the cloth masks. Then the air needs to be coming through the mask, and that provides a huge amount of more protection, both for other people and also for the wearer. We need to make sure there are enough tests so that people can self-test and isolate themselves when necessary. And as Christina said, vaccines are really, really important. We need to get the vaccination rate up, and we absolutely need to think about how we're going to protect our school children, particularly our primary school children. They don't have the air quality control, they don't have the masks, and every other country pretty much has started vaccinating their under 12s because it's shown to be safe and effective, and it's still really unclear why we're not getting on with that in this country. As a final thought, in terms of protection, we need to think about the global protection and distribution of vaccines, because we've been doing this for 2 years now. Everyone's getting really, really bored, bored of COVID. We'd like it to be over, but it's not going to be over as long as there are pools of infection all over the world, places where there's very, very little vaccination, and new variants will arise. If we want to protect ourselves and be in the long term free of COVID, our best way is to make sure that everybody in the world gets vaccinated. And there are many, many barriers, and many of them are political. We could do something about that, or the government could do something about that. Finally, the last part of our plan is about support. We want support for people so that they can isolate. And we need to give adequate sick pay for those who are unwell with COVID. There are far too many people who don't test and don't isolate because they just can't afford to. We need to improve our digital connectivity so that people can work from home well, so that people as students who need to work from home can do that too. They need to have laptops for student and school pupils. And we mustn't forget about the economy. People have often put the economy and health as kind of in opposition, but they're not. We can't have an effective and healthy economy without an effective and healthy population. And while the population is unfortunately so full of infection, we need to halt that, and we will need to support the economy and support businesses through this particular COVID surge. And we could also think really hard about grants to businesses and other venues so that they can make their places safer when people are returning. So to monitor and improve their air quality. I'm sorry that was a bit of a gallop through and without quite the slides we intended, but I hope that was clear what our advice is.
Thank you so much for that, Helen. That was brilliant. And the report, or those suggestions, those recommendations are up now on the Independent Sage website, which we were just sharing with you then. So we're now going to go to questions from the press and public, and I think starting with Nigel Nelson from the Sunday People. Nigel, over to you.
Hi, Alice. Thank you very much. Boris Johnson seems to think that we can outrun the virus without any protection, with any further protections. Christina was suggesting that we're nowhere near the peak of Omicron yet. Helen has just said that if we carry on the way we are, then schools and healthcare will cease to function. At what point are all these things coming together? When do we reach sort of critical time?
Thank you very much, Nigel. Who'd like to start with that? Christina.
Yeah, so, I mean, saying we're nowhere near, I think we actually are quite near. Probably, I think it will all come to a head about the middle of January. What worries me about schools is that you've got a population that isn't vaccinated, it isn't boosted, and is meeting every day in a very infectious variant. And so there's no reason to think that what happened last time isn't going to happen this term with spades on, because we know that previous infection from Delta does not protect you very well against Omicron. So that's kind of what's worrying me, and that it'll just make this longer surge than it needs to be. And that's bad for everybody, but particularly bad for children and people who work in schools. And also, I don't think we can outrun it. I think eventually there'll be another variant. I don't quite see why people think this is the last one.
Thank you very much, Christina. Professor Stephen Reicher.
If I could come back on the question, the problem is that when Boris Johnson is asked about COVID measures, he doesn't talk about protections. What he always says is, we're not going to restrict people and we're not going to lock them down. That's precisely what he said at his press conference this week. And so his strategy is to try and present any measures against COVID as restrictions, as taking away our freedom, as locking us down. And he says we will not have restrictions and we won't have lockdown. And of course, people don't want restrictions and none of us want lockdown. First point to be made is we probably should have had restrictions before Christmas and before New Year, but it's too late now. All the mixing took place, all the infections have seeded. We are going to see the surge over the next week or two, as Christina said. But We've got to make sure that that surge does not continue, that it's as short as possible, and what's more, that infections stay down. And that's why we emphasize protections, and that's why we emphasize support. The thing is, precisely, right now, the things we should be doing is making sure we don't get infected, making sure that environments are safe. And if you do that, if you make sure that, for instance, environments are safe, there's good ventilation in schools, and you make sure that venues are safe, and what's more, they advertise the fact that there's good ventilation, say in a bar or a restaurant or whatever. Number one, it protects people because it means they're less likely to get infected. Number two, it makes them more likely to use that facility and therefore is good for the economy. And number three, means that more vulnerable people who otherwise are afraid of going out can become more connected, and it's good for their mental health. So the point is, and this is what we're stressing, and it's the core point in our plan, is when Boris Johnson says no restrictions, no lockdown, fine, but what about the protections and what about the support? There are all sorts of things you should be doing, you could be doing, and you must be doing. And the final point I'll make is this. Let's use the example of schools. We all agree we don't want to close down schools. We don't want kids at home. We don't want kids, again, missing out on education. We don't want kids isolated. We don't want the mental health problems. But you can close down schools by policy, and Boris Johnson is opposed to that, and we don't think it's a particularly good idea. You can, however, also close down schools by neglect. And that's what's happening. Listen to the headmasters, to listen to all the information about either kids being sent home or about merging classes and merging subjects. You can close down schools by neglect. And that's what they're doing by not bringing down infections. Or the third option is to stop schools being closed down by taking measures of protection. And that's what we're calling for. And so each time Boris Johnson responds to that call, deflects it by saying, oh, we don't want restrictions and we don't want lockdown, then he needs to be pressed on the point that neither do we, but what we do want is protections, and what we do want is support.
Thank you very much, Stephen. That's incredibly clear. And Dr. Zubaida Khan.
I don't think we can underestimate how urgent it is to address the issue of school children being predominantly exposed at the moment. As Christina said, we've got primary school children who are completely exposed in terms of not having any vaccination at all. And we've got secondary school children where just a little over half of 12 to 15-year-olds are vaccinated. And other than that, there's very little in schools to protect children. We've got face masks in secondary schools, but no face masks in primary schools. And there's a real urgency here because it is about open schools, but it's also about safer schools. And right now, the two things that need to happen straight away is, first of all, we need to escalate vaccinations for all children, including doing something about 5 to 11-year-olds. Right now, we've got a standstill. We've got a horrible position right now where JCVI have only said that vulnerable 5 to 11-year-olds can be vaccinated. MHRA have said it's safe for all 5 to 11-year-olds, and we've heard nothing from the CMOs about 5 to 11-year-olds vaccinated. And something needs to happen. We cannot have a situation again where parents and children are put in that impossible position where it's either closed schools or unsafe schools.
Thank you very much, Zubaida. And thank you very much, Nigel, for that question. We've got a question coming in now from Owen Brody of Upday. Owen.
Hi, everyone. Without further restrictions, when do you expect the current Omicron wave to come to an end? And is it possible that cases will decline as rapidly as they've risen as more people become infected?
Thank you very much. Christina, in your presentation, you showed evidence that perhaps the wave is starting to come down in some age groups, but then of course schools have just gone back. When do you think it will peak, and how long do you think it will go on for?
Well, I think it comes back to the the age differences. So we've seen it peak in different age groups at different times. So for instance, we had a massive surge in July, which was mainly young adults. They were the lowest, some of the lowest groups all through autumn, while children surge. I think young adults will peak or have peaked, but now that children are going back to school, I think that will prolong it. And I think what will happen is that things will probably go down towards the end of January, but then potentially as the boosters wane, then their parents will start getting infected again. But it won't be like the numbers we're seeing now, but it means it's not going to fall to nothing as quickly as we would want, just because there's continued waves of people to keep getting infected. And unfortunately, although the boosters are amazing, or not amazing, but they are really, really good against hospitalization, they're not as good against infection.
Thank you very much, Christine. Does anybody else want to gaze into the future and wonder about how long Omicron is going to be with us as a wave? Danny? No. Martin, Professor Martin.
I was just going to say that the French government were saying today that they were looking at within another 2 weeks, they reckon, in France. So that might be some indication. But I think with all the caveats that we have, particularly around schools and the spread there.
Mm-hmm. And Anthony, Professor Anthony Costello.
Sorry, no, I mean, it raises, I mean, I'm sure what Christina says is right, and that this will come down fairly quickly. The big question to me is then beyond that. I mean, a lot of people have been saying, well, it's all over now because Omicron's milder. Well, we know it's not going to create herd immunity because it's going to decline very quickly. Will milder mutations come in that allow us back to normal? Can we assume that it's going to mutate down to a common cold? I'm not convinced by that. Maybe Danny will have something to say about that. Will it stay the same? In which case we will have similar waves at various times in the future. Could it get more virulent if there's masses of transmission around and masses of mutations? Is there any reason to expect that it won't perhaps come up with a nastier version? So, I mean, I think this is all the big questions for the future, which is actually quite worrying. Sorry to be miserable.
Thank you very much, Anthony. I mean, I think, we've seen with Omicron, haven't we, that, protections that we have in place are superseded quite quickly. And also the idea of herd immunity, whether that's an idea of herd immunity through infection, which nobody is a fan of, or herd immunity through vaccination, which we should be looking at. It's a transient phenomenon, and I think sometimes the way it gets talked about, it's as though you achieve herd immunity and that's it. That's the end of the line. We don't need to worry about COVID anymore. I don't know, Danny, what's your perspective on this?
Yeah, I'm just to say a word about the sort of common cold point of view. First thing to say is that people think that changing into something like the common cold happens overnight. They've been the four common ones that we have been with us for many hundreds of years, and it wasn't an overnight process. It was a very slow, painful evolutionary relationship. And the other thing to say, as Alice just said, that's obvious, is that, as we all know, your so-called herd immunity to the common cold is a very fragile and ephemeral thing, which is why we get them every damn year after year for perpetuity. So it's not a very good type of herd immunity, whatever it is.
Thank you very much, Danny. Thank you for that question, Owen. Jenny Edwards joins us now. You've got a question, Jenny.
Yeah, thank you. First of all, can I thank you all so much for what you're doing? It's been really valuable for me living alone to have your expert advice, fact-based. The booster program, we're told, is the answer to everything, but it started back in mid-September. I had mine in October, which is more than 10 weeks ago. Given what we now know about waning immunity and what we saw with Delta, what advice do you have for people who are older or clinically vulnerable who had their booster some time ago?
Thank you very much, Jenny. Danny, I wonder if I could come straight back to you on that one, the issue of waning immunity.
Yeah, I think it's a really, really hard question, isn't it? Because we all saw those graphs that Christina was showing, where you could extrapolate that even if people have had a boost, by the time again they get 3 or 4 months out, there isn't going to be that much protection there against Omicron or Delta, and so I don't have a magic answer except to say that I think the vaccines at the moment and the boosters are kind of a work in progress, because we never expected to have to do this boosting, and we had no contingency plan and no trials on it. But we do know an awful lot about vaccines, some of which are much more durable than these ones we're using now. And for my taste, I think we all need to do a bit more homework and look at ways of moving into booster programs that give us much more durable immunity that won't wane so fast.
Thank you very much, Danny. So that kind of dealt with the issue of waning immunity. What are the implications of that? Professor Susan Mickey.
Thanks, and thanks for that question, Jenny. I think none of us think that the vaccination is going to be a silver bullet, however effective and good it's going to be. And since we can't rely on further vaccinations to keep the protection up, I think we have to really change the way we do things. I think society needs to change the way it does things. I think the physical infrastructure needs to change. But in the immediate few weeks and months until any further vaccinations on offer, I think the key thing is to really develop our skills of assessing and managing the risk around us. So thinking about who you're seeing, are they likely to carry the virus? Are they teachers or in touch with other people where they may be infected? Can you see people either outdoors or ensure there's ventilation, or buy one of these air filtrations? I gather you can buy them for 40 or 50 pounds, the HEPA filters. Also things like, really going back to first principles, but this is airborne. Well, what does that mean? It means it hangs around for many, many hours. So if you're going into shops or going into a cafe or any indoor space, if you have to go for a dentist appointment or the hairdressers, try and get appointments or go out first thing in the morning, because there will have been the whole night to have got that air a bit clearer. So I think that's the route we have to go down. And I think we should really be trying to ask SAGE and other bodies to put forward a sort of package of measures of how people can protect themselves and also other people when we're going to only be partially protected and less protected over these coming weeks and possibly months.
Thank you very much, Susan. Yeah, we do need some really clear messaging around that. Jenny, I don't know if you're on Twitter, but Professor of Primary Care at Oxford, Tricia Greenall, she's just published a new paper on risk of transmission in different environmental conditions, which is an academic paper, but I think it's really useful, and it's got a lovely visual just for kind of looking at different situations and thinking to yourself, is there lower or higher risk? I think those kind of papers, putting them out there, the fact that Trish is putting it out there and we can all see that is incredibly useful. Thank you very much for your question. Let's move on now to Vicky, who's got a question about reaching the back of the throat with a short stick. Vicky, over to you.
Hi. Yes, so there's been a lot on the social media, and a lot of scientists have been talking about that the throat is starting to look like, with Omicron, the throat is detecting Omicron earlier. And so the old kits were like this swab and the new kit is like that. So it's not an easy task to do, but I haven't personally tried it yet. And I wanted the advice of the scientists if this is a good thing that we should be going back to the throat, and of course bearing in mind that you can't eat or drink half an hour before. And another kind of a related question is it possible that the Omicron escaped detection by us because of the fact that we were just swabbing our noses and not swabbing our throat anymore? Thank you.
Thank you very much, Vicky. Great questions there. Those obviously the tests that come with the short swabs indicate to you to only do the nose, but we are hearing these anecdotes about people swabbing the throat as well and finding that they're getting a positive. Are there any studies on this beyond the anecdotes? Professor Dean Pillay.
Hi, Vicky. That's a really, really pertinent question, and there are data coming out as we'd expect. All the different variants have emerged because they act in a little bit of a different way to the previous variants, and that includes precisely which cells they replicate best in. And nothing's all or nothing; it's all relative. And we just assumed always that these respiratory viruses will replicate in the what we call the upper respiratory tract, which includes the nasal cells as well as the throat. But I mean, when I've been for swabs undertaken by other people, I've had my throat swab, I've had one, both nasal cavities swab, one nasal cavity. There's clearly a variety of ways in which it's done. And you're right, is that the guidance is that, throat swabs shouldn't be done, within an hour of food or drink. And I think Susan identified that. I think we can safely say that much of that advice has been ignored because, of course, there's the practicality of more and more swabs. My sense is if it's all possible, put your swab both in your throat and both nasal cavities, and just to maximize the opportunity, which actually is a catch-all way of doing things. If the swabs are a bit a bit shorter, then just stick your fingers in more to get to the back of the throat, because that is where the virus does hang out. And so I would just have a belt and braces approach now, particularly as we're all increasingly dependent on self-swabbing, more testing all the time as a prelude to meeting people, going into spaces. So that would be my advice.
Thank you very much, Dean, and that's really useful. And thank you for your question, Vicky. It's quite a relief to me as well, because I have been doing the experiment, and with the shorter swabs, I can reach the back of my children's throats and get at their tonsils. Okay, a question now from Alex LeMay. Alex.
Thank you. You've pointed out that to get out of this COVID Groundhog Day with variants popping up around the world, we're going to need global vaccination coverage. So I'm wondering the perspectives. Is it fair, let alone effective, to ask low-income countries to vaccinate against COVID, whilst at the same time slashing international development aid?
Thank you very much, Alex. I'm going to hand this straight over to Anthony.
Oh, gosh, good question. First, the issue, of course, is even if we achieve global vaccination and if there's waning immunity, what we want is a global vaccine, as Danny says, that actually works with more stable vaccines that produce immunity for longer parts. The British government has actually slashed its aid program this year in all kinds of ways and diverted aid money. It's worse than it seemed at first. And you're absolutely right. The scandal of global inequity in vaccines is because, in my view, the production of vaccines has been completely hijacked by a number of companies who are using patent law for vaccines that actually they didn't pay for to develop, to prevent other producers around the world producing them. So in low-income countries, less than 4% of people are fully vaccinated. This is a year into the whole program. And we know that millions of people are going to die from all the variants circulating in the world if you have no vaccination. So I think this is we are culpable of, in my view, a crime against humanity. And I think I would go as strong as that. And the World Trade Organization have spent the last few months trying to get some kind of compromise, but the investors behind the big companies, because hundreds of billions of dollars are at stake, are holding firm, and it's putting money before lives, in my view. So I think your question is very pertinent.
Thank you very much. Anybody else want to comment on Alex's question about vaccine equity? I think Anthony summed it up extremely well. Helen?
I just wanted to say that right at the beginning of all this, there was a real problem about vaccine manufacturing capacity. There isn't anymore. If we wanted to, if there was a political will, there are no obstacles to lots of people in lots of places making loads of vaccine. It wouldn't even cost very much to do. It's not a practical problem. It is purely about money, greed, and politics. And those countries, I absolutely get, Alex, that there are lots and lots of other development goals and other health problems that are really important. But we should be able to solve this one, at least, if there was political will. It is entirely a political question, and it's a moral question, and we need to be pushing our government really hard on it.
Thank you, Helen. Stephen.
Yeah, I mean, there have been over 100 companies identified outside Western Europe and outside the US which would be capable of producing vaccines. There's production capacity all over the world. One would need technology transfer and expertise transfer, as well as waiving of patents, but it can be done. And it's one of those things, it's a bit like the debate on air filtration in schools. We suggested it over a year ago, and people said, "Oh, well, it'd take far too long to do. We can't do it." And they've been saying that every time we've said it. If they'd done it when we said it first of all, we should be able to have good air filtration or air purifiers in every single classroom in exactly the same way. Almost at the start of the vaccination program, it started off with India and South Africa, called for patent waivers to be lifted. And people said, "Oh, well, that's a long-term thing. There are short-term things." If it had been done now, at the beginning, then now we would be producing vaccines all over the world. And the other point to be made is, yes, it's the companies. Of course, it's the companies. I agree absolutely with Anthony on this. But if you want a pub quiz question, you might ask, what is one of the very few things on which the US, China, and Russia agree with Bill Gates and the Pope? And the answer is all of them support vaccine patent waivers. The UK is one of the very, very few governments which is still blocking them. So there is a political culpability, and we should be all now calling on our MPs, calling on this government to stop blocking patent waivers. It's one thing they could be doing today, and every day that goes past, more people are going to die.
Not Bill Gates, Steve.
I thought he changed his mind. He changed his mind.
No, he was never in favour of patent waiver.
Yeah, but he changed his mind to support them at one point. Anyway,
has he?
Yeah.
Okay.
We just need more people to, don't we? Thank you very much, Alex, for your question. I think I'm going to have to wrap it up there. We had a couple of other questions about advice, which I think actually we've already covered. And as we heard from Helen Salisbury, there are those new recommendations, and those are up on the website. And I think those are personally and socially useful. So let's bring it to a close. Thank you very much to the press and public for all of your questions. As always, please continue to submit them and to follow us on Twitter as well and feed those through. We are here to help you, and we'll try to answer as many as we can during these briefings. Thank you very much to all the scientists for your continued hard work. You have been and continue to be a vital resource for many, as we've heard today, offering clear guidance on how to safely navigate the pandemic. I'm going to leave you with a couple of updates on our team. Dr. Zubaida Khan has just assumed the role of Executive Director at the Equality Trust, and we'd all like to congratulate her on that new post. Professor Dinan Pillay, who has been at the helm of Independent Sage now for few months, will be stepping down as chair for 3 months now to focus on other commitments. And Professor Martin McKee is going to step in as our interim chair. We'll be back next week at the same time. Stay safe, keep well.